Thank you so much. Thank you for that lovely introduction. Thank you for that warm welcome. And thanks to Steve Shore and the whole Real Truth About Health team for making this all possible and inviting me to be part of it. Well, this presentation is titled What I Wish I Learned in Medical School About Nutrition. Those of you who've seen this before, I do have some new and additional information about cholesterol, et cetera. We'll get to that. But for those of you unfamiliar with my work, I want to give you a hopeful note about where medicine may be heading in the future. When I was in my pre-medical studies at the University of Illinois down in Champaign-Urbana, I minored in astronomy, and I learned a lot about black holes, and the actual physics behind them are not as relevant to our discussion today. But the black hole has become a symbol for just a complete void, an energy-sucking entity that doesn't nourish the things that people around it, kind of just swallows it up. And without being too harsh, and certainly no disrespect meant for my medical colleagues, this seems to be an area in medical education that winds up a complete cipher. You ask your doctor about what should I be eating for this condition or that condition, and kind of a blank stare appears. And most doctors' understanding of nutrition and the role that their patients' daily diet plays in creating and maintaining their diseases is kind of a black hole to them. And they say, listen, I never learned about nutrition in med school. No one really mentioned it seriously. There aren't any studies that says it makes a difference in any way. I don't have time to do nutritional counseling. I got a waiting room full of patients. I don't get paid for nutritional counseling. And besides, people are never going to change what they eat. They love their Big Macs and their pizzas. And people's food choices are cultural, and I can't change that. And besides, I like cheeseburgers and sausage pizza myself, but I take statins, so I'm protected. So it really doesn't matter. Send the patient to a dietitian. Don't bother me. I'm up in the operating room doing real medicine. And this is kind of the barrier that patients and nutritionally aware physicians run into when they talk to their colleagues about this subject. And then when you ask the doctors, by the way, you're treating my high blood pressure, you're treating my diabetes. Do you think these are reversible? Any chance I could not have high blood pressure the rest of my life? How about diabetes? Any chance I could get off my insulin? Oh, the vast majority of doctors will roll their eyes and say, listen, these diseases are relentlessly progressive. They just get worse. Nothing can reverse these diseases. We can just give you more and more powerful medicine. And I hope you don't have your stroke when I'm on call, but they don't say that. No, you get no real encouragement that you can ever get out from under these diagnoses, which is really sad, because I'll tell you why in a few minutes there. But with this stance that these are relentlessly progressive diseases and nothing can reverse them, and that's right, doctor, if you don't change the patient's diet or help them change, that is what you're going to see. Now, I hear this cynical, well, they're all getting fatter and sicker, they all need stents. That's right, doctor, if you don't help them change their diet, that is what you're going to see. But with that stance, the patient's health certainly suffers as these diseases progress. The patient's satisfaction with medicine, the physician's satisfaction with medicine wanes. They dread coming into clinic another day dealing with these folks who aren't changing, and they're just getting worse in their clinical condition. And our society pays for the stance. Trillions of dollars go down the black hole, if you will, of healthcare, where you do these $1 million bypasses on folks so they can go out and eat more cheeseburgers and buffalo wings and come in with their grafts clogged up. This is just cost society and money and lost productivity. It doesn't have to be like this. And the question I'm asking after 50 years in clinical medicine, what will it take to create a new generation of nutritionally aware physicians and dentists and nurses and physiotherapists, podiatrists, pharmacists, all health professionals need to have an awareness that what their patients are eating is the chief reason they're sitting in front of us, overweight, diabetic, hypertensive, clogged up, and inflamed. What will it take? As much as I was hoping that a tsunami of awareness would sweep through my beloved profession, indeed that has not happened. So like so many things in life, if you really want something to happen, then strap it on and work to get it done yourself. So to that end, we have established our Moving Medicine Forward initiative. And from 2017 to 2020, I was going to dozens and dozens of medical schools across North America, Canada, Mexico, Australia, New Zealand, Europe, and giving those first, second, third year medical students the lecture I wish somebody had given me 50 years ago, before pharmacosclerosis set in my brain, and these young students thinking that drugs and surgery are the only treatment for diseases. And I tell the med students, look, in med school, in pathology class, physical diagnosis, you are going to be learning how to diagnose all sorts of weird and wonderful diseases, from smallpox to leprosy. But when you get out in the real world and you open the door of the waiting room in your own medical clinic or in the emergency department, surgical outpatient, the people who are going to be sitting there are not going to have smallpox or leprosy, thank heavens. Now, what you're going to be seeing is a large group of people with a small group of diseases. The majority of them are going to be overweight, if not clinically obese. You're going to see rampant clogged arteries and atherosclerotic vascular disease showing up as elevated lipids, elevated blood pressures leading to strokes and kidney failure. You'll see florid type 2 diabetes in so many of your patients, and a host of inflammatory diseases affecting every organ system, lungs, gut, joints, skin. This is Western medicine in the 21st century. This is this small group of degenerative diseases that are going to take up the vast majority of every physician's time throughout their career, whether they're in surgery, internal medicine, pediatrics, pathology, respiratory, GI. They're all looking at new diseases that have the standard American diet as the fundamental disrupting cause. It's not the only issue. There are infections, et cetera. But our current Western diet certainly makes all these conditions worse, if not drives them to a fatal outcome. And yet when you look in the textbook or ask the professors, what's the cause of these diseases? You run into a thicket of biochemical mechanisms of this gene calling for that enzyme and this enzyme inhibitor dependent upon this mineral. And you wind up throwing up your hands and say, nobody really understands these diseases, etiology unknown. When the smart men and women work in those labs 24/7, figure it all out, they'll come up with a mesocillin, and I'll be able to give it to my patients, and they'll be magically restored to health. Till then, I'm happy just to keep their blood pressure under control, their blood sugars under control by raising their insulin dosage, et cetera. This has become Western medicine in the 21st century. And that really disempowers both the patient and the doctor, because if you don't know the real cause of the disease you're trying to treat, then you can't really cure it. You're kind of just managing. Now we'll manage your high blood pressure, you manage your diabetes. Well, that's not very satisfying kind of medicine. You're just going to watch the patients get steadily worse. And the very act of practicing that kind of medicine, you see this never-ending river of patients in the clinic, and you just wind up raising their insulin dosage, raising their statin dosage, raising their beta blocker dosage. Do you ought to lose some weight, Joe? Come back in a month. Let's see how you're doing. If this is the kind of medicine the doctors are practicing, they're going to leave medicine. It's so dismal because the very act of just giving the patient that prescription for the beta blocker or the higher insulin dosage is giving them a message. It's saying, you're going to be sick the rest of your life. You'll always be diabetic. You'll always have hypertension. You are never going to get better. The best we can do is manage your disease. You will now have the rest of your life. What a dismal message to give the patient. What a hopeless way to practice medicine. And really such an unnecessary approach altogether, because the reality is that every one of these deadly degenerative diseases are to a greater or less extent reversible. Every one of us who practices a lifestyle medicine and gets these folks on a really healthy, whole food, plant-based diet, cleans up their lifestyle practices, enough sleep, less stress, et cetera, we all see these diseases reverse. They go away. How exciting that you can that you can help these patients truly become healthier. Etiology unknown, really? Let's look at what our patients are eating. We've become a fast food nation in the past 50 years. So let's consider what the daily diet in the standard American dietary style does for the patient and the patient's body. If you're eating a whole food plant-based diet like I'm advocating, and so many of my colleagues are, if you have a meal of a nice colorful salad, green and yellow vegetables, a hearty vegetable bean soup, quinoa and zucchini boats here, some steamed green and yellow vegetables, and if an hour later I was to sneak up on you when you weren't looking, I have a needle and a syringe in my hand and draw 5 cc's of blood into a red top tube, let the blood coagulate, put it in the centrifuge, spin it down, and have a look at it. This is what we would see. The serum that rises to the top is crystal clear. You can read newsprint through normal serum. This is what your blood should look like after you eat a meal. But you have a meal of the standard Western diet, bacon and eggs for breakfast, cheeseburgers and fries for lunch, fried chicken or pizza for dinner. If an hour later I draw that same tube of blood, let a clot spin it down and have a look at it, I would see this creamy appearance on top of the clot there. This is lipemia. That means fat in the blood. Postprandial means after eating. So this is fat in the blood that shows up after eating a fatty meal. Now, I will grant not everybody shows the fat this optically densely, but everybody has a wave of fat that goes to your bloodstream after you eat a fatty meal. How can you not? Where else is the fat going to go? And your blood stays fatty for 5 solid hours. Here is Kuo's classic study. They gave someone a fatty meal at hour 0, and they drew blood once an hour for 6 hours. They took those 6 blood tubes, put them one after another into an instrument measuring how fatty the blood is getting. And here you can see the blood getting fattier and fattier and fattier. It takes the liver about 5 hours to begin to clear the fat out of the blood. Well, think about what this means for people eating the standard Western dietary style, because during that time the blood is fatty, the artery walls are injured, the endothelial linings are getting abraded, the fat flows through the fat stores, obesity increases, insulin resistance gets worse as the fat works its way into the muscle and liver cells, and the saturated fats are pro-inflammatory. It sets off inflammatory reactions throughout the body. Well, on a typical eating day, a person starts off with bacon and eggs or an egg muffin, and for the next 5 hours, their arteries are injured, obesity is increasing, diabetes getting worse, inflammation's going up. It takes the liver till about noontime to begin to clear the breakfast fat out of the blood, when time for lunch and another wave of fat goes through the bloodstream, and all afternoon the arteries are injured, obesity is increasing, inflammation getting worse, diabetes more severe. Takes the liver till about 6 o'clock at night to begin to clear the lunchtime fat out of the blood, when time to visit the colonel and send another wave of fat through the bloodstream, and all evening. Obesity is increasing, arteries are getting injured, diabetes getting worse, inflammation going up. Takes the liver till about 10 o'clock at night to begin to clear the dinner time fat out of the blood, when on the way back to the bedroom, we polish off that half pint of ice cream and send another wave of fat to the bloodstream. And the reality is that most people in America are keeping their blood fatty all day. We simply do not tolerate hunger in our society. We're so affluent that as soon as you get it all growly or munchy, if you're home, you open the fridge, stick your head in for last night's leftovers. And if you're out, you head to the convenience store or the restaurant and have something to eat. We are constantly in the postprandial state. And I'm using fat as a marker, but it's not a matter of just eating a low-fat diet. The fat marker shows how long a meal inflicts adverse effects upon our body. There's more than fat in that blood. It's a high salt diet. There's salt in the meat, salt in the cheese, salt in the fries, salt in the chips. This not only stiffens our arteries, makes us retain fluid that raises blood pressure, leads to strokes and kidney failure, but also we're now seeing that high salt diets activate immune cells that open the door to lupus and autoimmune diseases. So the high salt in the bloodstream after processed food meal, not so healthy. And then there's sugar. And I'm not talking about a half a teaspoon of syrup in your, of sugar in your tea. I'm talking about eating sugar as a food. When you're eating a candy bar, a donut, a piece of coffee cake, it was never meant to be eaten as a food. And as a result, when you eat these kind of foods or drink a cola, your proteins are flooded with sugar all over the body, and the sugar molecules stick to the protein molecules. We say it glycosylates the proteins, and your own body heat then degenerates these glycosylated proteins, these oxidized, bastardized proteins, into this mat of free radical laden oxidized glycosylated proteins called advanced glycation end products. Nasty stuff. Bakers use this in the bakery, but you don't want to run the Maillard reaction with sugar and proteins plus heat in your own body tissues. You don't want to run the Maillard reaction in the crystalline proteins of the lens of your eye. It's a great way to open the door to cataracts. You don't want to run the Maillard reaction through the elastin fibers in your skin. Is a great way to turn your skin into an old suitcase. And you sure don't want to run the Maillard reaction on the inner lining of the blood vessels of your brain. This is the membranes across which oxygens have to travel and nutrients. And I'll show you how the brains of Alzheimer's patients are different than those folks not eating a high AGE diet. Now, I said a lot of the AGEs come from cooking carbohydrates at high temperatures, but the most AGEs are generated by cooking meats, so the fried chicken and the burgers and the bacon. This is where most of the AGEs come from. And they really age us, including the blood vessels in the brain. Here are the arteries of two men, died at the same age. This man did not have Alzheimer's dementia. This man did. And when you analyze the arteries, you find out they are riddled with advanced glycation end products. The acronym AGE is really appropriate. Eating a high AGE diet ages us. So all the changes and the damage that I mentioned can be done with vegan junk food, with the chips and the fries and the pastries, etc. So you don't want to be a vegan junk food addict. I've got overweight vegans with gout. I've got overweight vegans with clogged arteries. One just had a stent. So just because you're vegan doesn't mean you're eating healthy. You want a whole diet made of whole plant foods. We'll talk about that in a minute. So beware of vegan junk foods. But that said, when we eat a meat-based diet in our society, most everybody with every meal, there's a piece of animal muscle in some form in the center of the plate. If it's not there, you get upset at the waiter or the waitress and say, "Where's my protein?" But so most people are eating a piece of animal muscle 2-3 times a day. Let's look at what that really adds to the bloodstream after every meat-based meal. First of all, you put a surge of oxidized cholesterol. We'll come back to this, but it's the oxidized cholesterol that spawns the atherosclerotic plaques as the oxidized cholesterol particles work their way into the walls of the arteries. Cooking animal muscle oxidizes the glycogen, nucleic acids. You wind up generating reactive aldehydes, glyoxyl and acrolein. These are mutagenic. They damage your genes. Your genes call forth your enzymes, and a wave of reactive aldehydes sweep through your bloodstream and through your tissues and cells with every meat-based meal. New 5-GC, this is a sialic acid that only animals make. And it generates inflammatory reactions throughout the body. And then there's endotoxin. Where does endotoxin come from? It comes from the slaughterhouse. All animals pass through the slaughterhouse, even organic grass-fed beef. And as the carcass is hung up and eviscerated, the guts, the intestinal tract removed, it's inevitable the intestinal contents spill out. And you can take a culture tube and swipe it on any cutting surface in the meatpacking plant, and you can culture E. coli and Salmonella and Shigella and Enterococcus and Pseudomonas and all the whole rogues gallery of bacteria that cause so much damage in the body. Well, that means that every steak and chop and chicken breast that leaves the slaughterhouse has a coating of these bacteria on its surface. It's wrapped in plastic, sent to the meat case in your local supermarket, where the ultraviolet light shines down and kills the bacteria. And as these bacteria die, their cell walls break up, and their cell walls release this nasty lipopolysaccharide called endotoxin. Any doctors working in intensive care unit knows endotoxic shock. This is nasty stuff. You can take a walk around this daisy of death and see what endotoxin does. Releases free radicals, depresses the heart muscle, releases histamine, sets off blood clotting. And endotoxin is heat stable. Cooking the burger or grilling the chicken breast does not get rid of the endotoxin. And our friends eating the paleo style diet are giving themselves a shot of endotoxin 2-3 times a day. Endotoxin also makes the gut leaky. It increases intestinal permeability, and that's going to allow bacterial products and food proteins to leak out and flow through blood, through tissues throughout the body, setting off inflammation and autoimmune disease. Then there's TMAO, trimethylamine oxide. What's that? Well, the food we eat determines the microbes that live in our gut. And if you are eating a meat-based diet, then or an egg-based diet, you're going to be eating lots of molecules like carnitine and choline. That summons up microbes that eat carnitine and choline, like Streptococci and Clostridia, and they turn that carnitine and choline into trimethylamine. And your liver then oxidizes that to trimethylamine oxide. This is a nasty molecule, drives cholesterol into the artery walls and prevents HDL from taking the cholesterol back to the liver. The folks who eat a meat-based diet, like the paleo folks, generate lots of TMAO in their blood, and we see that high TMAO levels lead to a higher death rate and of adverse cardiac events. Cooking animal muscle inevitably produce cancer-causing amines that rub on the stomach wall. You get gastric cancers, rubs on the colon wall, they get colon cancers. When you eat meat, a surge of amino acids washes up through the liver. Well, the liver responds by putting out a very powerful growth-promoting hormone called insulin-like growth factor 1. This sets off growth in tissues all over the body. Great if you're a growing 9-year-old boy, not so great if you're a woman with an early breast cancer or a guy with a big prostate with a couple of malignant cells. The last thing you want is a high level of IGF-1 in your bloodstream, and that's what a meat-based diet keeps flowing through your tissues. Heme iron makes red meat red. Unfortunately, the body can't keep it out. Even if your tissues are full of iron, heme iron barges in and creates iron overload, and that opens the door to strokes and cancers. And finally, the animals in the feedlot are fed bushels of grains that are sprayed with pesticides and herbicides. They drink water with cadmium, mercury, lead in it, and all these contaminants bioconcentrate in the animal's flesh. And so every time you bite into that factory farm chicken breast or burger, you're eating all the concentrated toxins that that animal ingested throughout its life. So this is the reality. This is the entire tier of disrupting molecules that the folks eating a meat-based omnivore diet floods through their tissues meal after meal, month after month, year after year. And that gives me great concern for the folks who really do eat this paleo diet. They often get initial improvement because they stop eating dairy and oil and flour products, and that indeed will make you leaner and healthier, and insulin action improves, and lipids often get better. And people say, see, paleo diet is the way to eat. But really, they're stuffing their intestinal tract full of decaying animal flesh 2-3 times a day for years. I think these folks are opening the door and welcoming in an epidemic of colon cancer. All the TMAO they're going to generate is going to give them a tsunami of heart attacks and strokes. The gut bacteria that the meat summons up injures the gut wall. They get leaky guts. This is going to open the door to lupus and autoimmune diseases. All the fat in the meats and the oils paralyzes the meats and the fatty foods paralyzes their insulin receptors, and they get type 2 diabetes. The bacteria really inflame the gut wall. They're going to get Crohn's disease and colitis. And I showed you what a diet full of AGEs from the meat, et cetera, does to the arteries of the brain. I think they're opening the door to dementia as well. Time will tell. I don't wish anybody ill, but as an experienced physician, I have grave concern over what this very trendy fad diet that people are recommending. They like the taste of steak in their mouth, but I think the price for it is going to be excessively high. So what I'm saying is that if you're eating the standard Western diet, meat, dairy, oil, sugars, etc., every meal you're flooding your tissues with this panoply of molecules that cause mischief. I call it the postprandial red tide. And these are the majority of the molecules. We've talked about them. It's a fatty tide. It's a salty tide. It's sugary. It's antigenic, sets off immune reactions. It's acid forming. All the phosphates and sulfates generate phosphoric acid, sulfuric acid. It's mutagenic, damages your genes. It's carcinogenic. It promotes cancer growth. It's atherogenic. It promotes plaque in the arteries. It is pro-inflammatory from the saturated fats, and it's disruptive to enzyme systems throughout the body. That's the nutritional red tide. It's a concept that I've created. You won't find it in the textbooks, but it's a handy mental picture to have. And the reason I chose it is because when a real flood tide is flowing through your house, it's pretty distressing to see your sofa floating down Main Street. But what really has you upset about that dirty floodwater in your house is what that dirty floodwater is going to leave behind, the stain in the carpet, the baseboards, the drywall that makes you rip out the tissues of the house and do a major overhaul. It's what the red tide, it's what the tide leaves behind. Well, the red tide in our body leaves its own kind of stain, and it's in the form of disease and dysfunction. Won't give any equations here, but food effects over time equal the health effects. And really, we have to honor the fact that if you're eating 3 times a day, every year, over 1,000 times a year, you flooded your tissues with these red tide molecules. And how can this not have an adverse effect? I tell the med students, when you open up the exam room door in your outpatient clinic, when you see the man with the angina and the woman with the asthma and the man injecting insulin for his diabetes and the woman struggling with acne, these are not random events. This is not bad genes. These are largely the effect of the red tide flooding through their tissues, meal after meal, month after month, year after year. And we have to realize how powerful this effect is. Within minutes of eating anything, our digestive system is so efficient that molecules of that mouthful of food you just chewed up and swallowed, within minutes, the molecules of those foods are flowing through every cell in your body where your DNA lies unfolded. And the food molecules wash through the cells and they wash over your DNA molecules and they play your DNA like a piano. And they turn genes on, they turn genes off. They induce enzymes, they shut enzymes down. Every meal brings in not only nutrients, it brings in information. Our food changes us on a genetic, molecular level. And you don't need to be a geneticist to understand that the genes that are going to be turned on by this steak with all the oxidized cholesterol, reactive aldehydes, B5GC, endotoxin, carcinogens, AGEs, the pesticide herbs, the genes that are going to be turned on by this panoply of disrupting molecules who we know turn on genes that promote aging and inflammation and autoimmune disease and cancer. Those genes going to be turned on by this steak are a totally, completely different set of genes that are going to be turned on by this salad that washes the cells filled with a mixture of phytonutrients that are antioxidants. They quench free radicals. They stabilize membranes. They promote tissue repair. They give the chemical message to the tissues, shh, calm down. It's just rice and beans and greens and fruits and veggies. Relax. Does not need to big inflammatory response as these molecules wash through. Your genes may load the gun, but your diet and your lifestyle pulls the trigger. You may have a genetic propensity in your family for diabetes or high blood pressure, but whether that disease actually manifests largely, not completely, but largely depends on the food you are flushing through your tissues, meal after meal, day after day, year after year. Here's a graphic example of how powerfully food can change the nature of our tissues. This on the left-hand panel here, this is the genetic readout of a man with early stage prostate cancer. And all these red dashes here, these are genes called oncogenes. Onco means cancer. They they promote the growth of cancer. They put out enzymes, et cetera, that help the cancer tissue grow more aggressively. Well, this man went on a whole food plant-based diet and for 6 solid months just ran healthy salads and vegetable soups and stir-fried Asian curries and Mexican bean chilies and all this wonderful plant-based meals through his prostate gland week after week for 6 solid months. They then did another biopsy. Same man, same prostate, same genes. And look at the difference. Look how many of these previously active oncogenes have now been silenced, have now been turned off and are no longer promoting cancer growth. What a powerful tool, how we can, and the patient really can reach into their very cells and change the genetic machinery in their tissues to be a more health promoting variety of genes. How can we withhold this information from our patients? What a powerful tool. Every meal makes a difference. You know, your body is never not looking. You're no fooling your liver, no fooling your arteries. They know what you ate. And you can see every cell in your body knows what you eat. Shakespeare says, to thine own self be true. Dr. Klaper says, to thine own cells be true, to thy own tissues be true. Every meal changes us in one of 2 ways. It changes us either directly, epigenetically, like new 5GC turns on inflammation, but also the food we eat, as I showed, changes the microbes that live in our gut, and they change us because their byproducts are molecules like serotonin and norepinephrine and dopamine. And these molecules get into our bloodstream, into our nervous system, change our moods and our perception. Food is so powerful. We can't just use it for entertaining our tongues. We need to create a healthy body with every meal. And I tell the young med students, look, if you practice medicine just focused on diagnosis and treatment, and you're totally oblivious to what might be causing these diseases, as I was for the first 35 plus years of my medical career, then it reduces you to the plight of the blind man and the elephant. And you probably ran into the old Indian fable, a group of blind men come across an elephant. Each grabs a different part. One grabs the tail, says the elephant's like a rope. One grabs the trunk, the elephant's like a snake. One grabs the leg, the elephant's like a tree trunk. They all have hold of the same elephant, but none of them has the faintest clue what a real live whole living elephant really looks like and what it really is. Well, that's the same predicament the physician puts themselves in, who does not take the patient's diet into account. And especially the specialists are in their cubicles trying to reason out what's happening with these various diseases. The cardiologist sees the clogged arteries. The internist sees the high blood pressure. The physiatrist sees the sore joints. The endocrinologist sees the type 2 diabetes. The rheumatologist sees the lupus. The dermatologist sees the psoriasis. The neurologist sees the dementia. The gastroenterologist sees the colitis and the Crohn's. The general surgeon sees the diverticulitis and the cancer. And they're puzzled. They're hoping that someone gives them the clue to understand all these, quote, different diseases. But they said, gee, they all have something in common. They all involve inflammation. They all involve free radicals and oxidative stress in the tissues. What could be causing these same mechanisms to show up in all these, quote, different diseases? It makes me want to go to each of them, give them a big hug, and whisper in their ear, doctor, do you think just maybe that what you're looking at is the effect of all these disruptive toxic molecules from the standard diet flushing through their tissues meal after meal, month after month, year after year? Might that be? I mean, no, never before in history, for 20 million years, we were plant-eating hominids. We have the same digestive system, basically, that our gorilla and bonobo cousins have. And they're up in the trees eating leaves and fruit, and when we eat a whole food plant-based diet, our body hums right along with it. It's when we eat the food of the mountain lion, and pretend we're flesh-eating apes, and a bunch of processed foods, the white bread and the cola drinks, then we set off all these disruptive processes. So I tell the young med students, I wish someone had told me when I was a student. Listen, when you open the door to go into the exam room, it's never just you and the patient. It's always you, the patient, and the patient's daily diet for the past 10 or 20 years. It's what they're flushing through their arteries with every meal. That's the invisible sculptor that's chipping away at the inside of their artery walls, the beta cells in their pancreas producing insulin, et cetera. We can't neglect the patient's diet. The food effects over time equal the health effects. And the really good news that I was whispering about the fast food diet as a cause of these diseases into the specialist's ear. The good news that I would yell loudly and clearly is, the good news is, you really want to heal these patients, then get them on a diet made of whole plant foods. It is stunning, the improvements we get to see, all of us who practice a whole food, plant-based lifestyle medicine. Have many patients, just like Emily, one of Dr. Furman's patients, who I know very well. Emily used to look like this. She was on 2 medications for high blood pressure, on 30 units of insulin, went on a whole food plant-based diet, took a walk every day. 11 months later, this Emily turned into this Emily. Normal blood pressure, normal blood sugar, off her medication. She no longer has hypertension, no longer has type 2 diabetes. What greater gift, I asked the students, could you want for your patients than to help them achieve this level of health? I mean, why are you going into medicine? Isn't this the apex, the epitome of really helping your patients achieve glowing health? And I kind of hinted this early on, but what I'm telling young med students, incorporate this into your healing strategy with every patient. Look for places where you can reverse disease. These are largely these are reversible diseases. I wish someone in med school said, instead of just chasing the insulin, the blood sugar numbers of your type 2 diabetics, most of them are, how about help them get rid of diabetes altogether? Let's open up their insulin receptors. I'll show you how to do that in a minute. Your patient with the angina, clogged arteries, chest pain when they walk, and instead of sending them to the cardiologist and send them right to the surgeon, how'd you like to melt away those plaques from the inside? It's reversible disease. I wish somebody had told me that. Now, granted, back in the 70s when I was in med school, we didn't really know much of that, but we know it now. And the young students need to incorporate this very powerful concept into their approach to every patient. It's a thing, disease reversal. There's even an international journal devoted to disease reversal, the international IJDRP. And this is a thing that every young graduating med student needs to know about. Every health professional needs to look for places they can help their patient reverse these diseases so they can get on living their lives as healthy human beings, not professional medical patients. So I'm making some pretty bold claims here that a whole food plant-based diet can reverse these diseases. Well, the scientists in me, and I would assume in you, said, well, come on, how does that happen? Well, there's magic in kale, I don't know, that kind of magic, rabbit out of the hat magic, but powerful effects. So let's have a look. Why and how does a whole food plant-based diet help to reverse these diseases? Well, first of all, here we are back and the person's eating the standard Western diet, and meal after meal, they're running the whole red tide through their tissues, especially the meat-based ones, because most folks have a piece of meat with every meal. And we see the disrupting effects that all these molecules have in the body. Well, as soon as one goes to a whole food plant-based diet, as soon as one decides to choose the bean chili instead of the beef chili. That's the whole great sacrifice we're asking people to make. And the bean chili tastes just as good as the beef chili. And all that is implied by that. When you have a choice, go for the plant-based option. As soon as you choose the plant-based option, the first and most profound thing happens is all these toxic, disrupting, chaotic, generating the molecules, poof, they're gone. The onslaught stops. Now the body can take a breath, so to speak, and get on with real tissue repair, because we have powerful mechanisms in every one of our cells, every one of our tissues to repair damage. So first of all, you allow tissue healing to happen. Then the profound biochemical changes that you have now created by going from an animal-based diet to a plant-based diet start having their effect. Excuse me. First of all, it's a high water content diet. There's a lot of water in the soups and the salads and the fruits and the steamed veggies. And all that water, first of all, it flushes through your tissues. It's like taking your cells to the car wash, and it helps flush out a lot of the accumulated disruptive molecules that pile up in the cells over time. But also, all that water in the bloodstream makes the blood less viscous. It flows more easily. The blood isn't so thick. And this more free-flowing blood flows through the arteries, and all the green leafy vegetables help the artery walls generate nitric oxide, and that makes the blood vessel, the arteries, dilate just a little bit, but they open up. And the slight vasodilation combined with the more free-flowing blood, that not only lowers blood pressure, and people can get off their blood pressure pills, but that increases oxygen delivery to the tissues, increases nutrient delivery to the tissues. When you go from animal foods to plant foods, you wind up pulling out the arachidonic acid. This is a powerful omega-6 fatty acid that generates inflammatory prostaglandins in the tissues. Well, you pull that out, you change the fat balance in the tissues, and what you plug in are the plant fats. Many of them are rich in omega-3 fats that have anti-inflammatory properties. So you have changed the fat balance, changed the inflammatory balance in tissues throughout the body. How profound. As I mentioned, the Western diet with the cooked meats and the processed foods puts a lot of free radicals, these very powerful oxidizing agents, molecules into the tissues. Well, all the fruits and vegetables have antioxidants that neutralize free radicals and lowers oxidative stress. You change the microbes that live in our gut. When you're eating meat and dairy, you spawn pathogenic microbes like the Bacteroidetes species. Well, when you pull the meat and dairy out and you put in a high fiber plant-based diet, you foster the growth of beneficial Prevotella microbes, and they are anti-cancer, they're anti-inflammatory, and they put out more of these neurotransmitters that can improve people's moods and outlooks. And people often say they feel better emotionally on a plant-based diet, probably some solid science behind that as well. Of course, pulling out all the cow cholesterol, chicken cholesterol, pig cholesterol, and the heavy saturated fats going to change the blood lipids, so they'll be less likely to form plaques there. Skin oils change. They're made from the fats in your diet. Guys notice their body odor often disappears. When people stop consuming cow's milk made from the milk of pregnant cows, the estrogen levels fall, IGF-1 levels fall, breast lumps can start to recede, that tumor promoting effect dissipates. High protein diets are not gentle with the kidneys. They make the kidneys go into a state of hyperfiltration. It damages them over time. Well, that hyperfiltration disappears. Now, on every level, the lungs seem to work easier. The asthmatic folks seem to do better. The immune system functions well. Everything changes in the body. It's not a brag or boast to say it changes everything. And I could spend 3 lectures on going through each one of these organ systems to show how changing from an animal-based diet to a plant-based diet benefits these tissues. It is so profound. Can you get enough protein? Absolutely. People don't think they're going to get kwashiorkor if they don't eat meat. But, ask any gorilla, ask any buffalo, any giraffe, any elephant. Can you make mammalian muscle out of plant foods only? Well, of course you can. So a day of oatmeal and fruit for breakfast, lunch of salads, soups, a veggie burger here, and a sweet potato dinner, some bean burritos and some green and yellow veggies and some fruit with oat milk in the evening. You can easily top 80 grams of protein with that and plenty of fiber. It absolutely is a healthy diet. So let's talk about two diseases and the specifics about why changing to a plant-based diet improves the outlook for these folks. So type 2 diabetes, here's, when we hear diabetes, sugar, got high sugar, don't eat sugar, no, bad carbs. The problem isn't the sugar, it's the fats. The sugar, it absolutely goes up to high levels, but that's the tail of the dog. That's just the effect of eating a high-fat diet. Here you see a muscle cell. Our preferential fuel is glucose, sugar. We are sugar-burning organisms. Our mitochondria are looking for glucose molecules. Normally, when glucose shows up in the blood after you eat an apple, the pancreas senses it, puts out insulin. Insulin activates the insulin receptors and allows the sugar into the muscle cell to be burned. Yay, that's the way it's supposed to work. But you've been eating the standard Western diet and keeping the blood fatty month after month, year after year. This fat works its way into the muscle cells. You can see it. I'll show you in a second. It's called intramyocellular lipid. This is fat in the muscle cell. This is not, and it gums up the insulin receptors. This is not theoretical. Here's what it looks like. Under the light microscope, this is striated muscle, like on your arm. And all this black stuff here, this is fat in the muscle cell. This is intramyocellular lipid messing up the enzyme systems, blocking insulin from working. This is how it looks under the light microscope. Here's what it looks like under the electron microscope. Again, fat in the muscle cell should not be there. This is what happens when you eat a high-fat diet. This is why so many people develop type 2 diabetes because, I'll show you why. For the science buffs in the audience, here's the way it's supposed to work in that here's those sugar molecules. Normally, when sugar's in the blood and the pancreas puts out insulin, insulin activates two kinase enzymes. This K here, it's a serine kinase, and this K down here. And these two active enzymes activate the GLUT4 mechanism, and that allows the muscle cells to pull sugar molecules into the muscle to burn it. Yay, that's the way it's supposed to work. But if all your cells are loaded up with that intramyocellular lipid and the mitochondria are full of it, then as those lipids, though the intramyocellular lipid oxidizes, it generates free radicals, reactive oxygen species here, and ceramides. And these molecules interfere with these enzymes. So insulin knocks on the door, but nobody answers. The GLUT4 mechanism does not come up. And as a result, the sugar stays out in the bloodstream, rises to high levels, causes all sorts of problems. But the problem isn't from eating too much sugar, it's the fat in the bloodstream, and it works its way into the muscle and liver cells. If you want more documentation, do some searches on intramyocellular lipid and insulin resistance. You'll see there's a solid mechanism behind this common phenomenon. Now, doesn't have to be like that. Here's a teaching aid I use my patients. I say, look, all this fat from your standard Western diet is clogging up the insulin receptors on the inside by neutralizing those kinase enzymes. But also, if the person is obese, they have their abdominal visceral fat inside their abdomen is releasing molecules called inflammatory cytokines like interleukin-1, interleukin-6. They interfere with the insulin receptors from the outside. So no wonder so many of our obese patients develop type 2 diabetes. They're clogged up on the inside of the insulin receptor, interfered with on the outside. So it's a common condition, not incomprehensible. The good news is it's reversible. If one stops running all that fat through the bloodstream and adopts a diet based on whole plant foods, This young woman here, as long as she's eating a whole food plant-based diet, will never become obese. She will never clog up her insulin receptor. She's never going to develop type 2 diabetes. Raising a child on a plant-based diet is one of the greatest gifts you can possibly give them. Another subject for another lecture. But if someone has type 2 diabetes and adopts this kind of eating style, and it's more glorious than just the tomatoes and broccoli here, but that's symbolic for a whole food plant-based diet, the disease reverses. How? Well, the fat that's in the muscle cell, when suddenly there's this nice, clean, sugar-rich fuel coming in, by these stored fats, let's burn them for energy. And the intracellular lipid is metabolized for energy, so it disappears. And as the belly fat starts melting away, those inflammatory cytokines, they fade away. So suddenly the insulin receptors are free to work, and they do. And suddenly the person needs less and less insulin. You can finally stop their insulin and get them off the metformin. It's a reversible disease. I wish somebody had told me about this, but I'm telling the medical students, Dr. Barnard and others have done studies showing clearly that a low-fat plant-based diet is even more effective than the American Diabetes Association diet. You get a better reduction in hemoglobin A1C, they lose more body weight, their lipids improve more, their kidney function improves. It really is the definitive treatment for type 2 diabetes. And we all have patients like Jim here who used to look like this, 100 pounds overweight, went whole food plant-based, dropped the weight, dropped the diabetes. Now he's running marathons and he's off his insulin. So yay, hope for people with diabetes, hope for the professionals treating these people with diabetes. You can watch these people get healthy. It's one of the most exciting transformations in medicine. To say those words, stop your insulin, you don't need it anymore. What a gift to help your patients achieve. Now let's talk about the biggest killer in America and in all Western societies here. Every 40 seconds, somebody grabs their chest and falls over with a fatal heart attack because the arteries in their heart are caked up with these inflammatory atherosclerotic plaques. The plaque is developed over years. The plaque can tear, expose the cholesterol underneath. That sets off a blood clot. The blood clot stops the blood flow, and the tissues downstream die. In the heart, they get a heart attack. If it happens in the brain, they get a stroke. You can see this person have multiple strokes, these white areas of scar tissue. These are all little mini strokes this person had. This is what vascular dementia looks like. It's present. Anyone who's eaten the standard American diet for more than 40 years has atherosclerotic plaques in their arteries. Assume so. Studies clearly show that. And going out for a long run or running a marathon will not burn those plaques off your artery walls. They are in the wall of the arteries. The marathon runners who eat the standard Western diet have just as bad arteries as the folks who aren't runners. So you can't rely on high intensity physical activity to protect your arteries. It's a good thing to do to stay in shape and all that, but it will not burn these plaques off your artery walls. Now, people focus on your cholesterol. Should I be on statins? My cholesterol is 210. I get calls every month from 2 or 3 vegans, all freaked out that I just had my lipids measured. My cholesterol is 204. My doctor's all upset. He's going to have a heart attack. He wants to put me on statins. Am I in danger of this, doctor? I've eaten a whole food plant-based diet for 15 years. Am I really having to go on statins? To those folks, I say, listen, your cardiologist means well, but to focus on how high is your cholesterol, what's your particle number, what's your particle size, what's your ratios, to focus on these numbers, I think misses the point. In my way of thinking, the question is not how high is your cholesterol. The question is, how healthy are your arteries? What's really going on in those artery walls? Now, how healthy is your endothelial lining? Do you have that inflammatory fire burning in the walls of your arteries? That's the real issue. This is an inflammatory disease. This is not just the globs of LDL that's stuck to your artery walls. This is an inflammatory process because these artery walls are getting injured meal after meal. What sets off the inflammation? Well, it's that delicate one-cell thin endothelial lining that suffers the brunt of the Western diet, where meal after meal, bacon and eggs, fried chicken, cheeseburgers, sends a flood of cooked animal muscle full of free radicals. The French fries, the onion rings are full of French fry oils, full of free radicals that damage the endothelial lining. The processed food, the chips are full of AGEs, the meat's full of AGEs, all the food chemicals, the colorings and flavorings can damage the endothelial lining. The sugar, the high fructose corn syrup, the maltose, dextrose, they injure the endothelial lining. Uric acid from meat production does it. The phosphoric acid in cola drinks that gives those drinks their bite on your tongue there. This chemical onslaught, the red tide, damages the inner endothelial lining meal after meal, month after month, year after year. Then, once the endothelial lining has been injured, we got to look at the role of oxidized cholesterol. What do we mean by that? Before we talk about oxidized cholesterol, let's understand that cholesterol is not an evil molecule. I mean, that's why your liver makes it. And liver makes it for very good reasons. Your adrenal glands use cholesterol to make cortisol and aldosterone. Your liver uses cholesterol to make bile so you can absorb your fats. Your ovaries, if you have them, use cholesterol to make estrogens. If you have testes, it makes testosterone out of them. Every cell in your body uses cholesterol to construct new cell membranes. And the body stores omega-3 fat, DHA, EPA, out in the bloodstream on cholesterol molecules. Body's got lots of uses for cholesterol. And just because your cholesterol is 204 does not mean you've got the disease of atherosclerosis. Your liver might want 204 milligrams of cholesterol in your blood for its own reasons. For your adrenals need more to make more steroids. Your liver needs to make more bile. But it doesn't necessarily mean you have the disease of atherosclerosis, and you need to pound that number down by inhibiting the enzymes in your liver that make your own cholesterol, which is what statins do. It's what I call the tyranny of the numbers. That's all the doctors focus on. But that misses the point. The real issue is the oxidized cholesterol. What does oxidize mean? Oxidize means to rip electrons off. We see when you oxidize iron, that creates rust. Well, these substances that flow through the bloodstream and the digestive system with every meal are oxidizing agents, and they rip electrons off of the abundant cholesterol molecules and turns normal cholesterol into cholesterol peroxides. And these are oxidized cholesterol molecules. They are highly atherogenic. They work their way into the wall of the artery, which is what this is. Here's that precious endothelial lining. The oxidized cholesterol particles penetrated, get into the wall of the arteries, set off an inflammatory reaction. That summons in the monocytes to come in and gobble up, phagocytize the oxidized cholesterol molecules and turn them into foam cells. And it's the foam cells that creates these atherosclerotic plaque. These are active inflammatory lesions. And just knowing your LDL number or your particle size does not let you know whether you have this inflammatory fire burning in the walls of your arteries or don't you. This is an inflammatory process. And as the plaque develops, inflammatory markers come into the bloodstream. So when my freaked out vegans call me, I've got a cholesterol 214, and my doctor wants to put me on statins because he thinks I'm going to have a heart attack. I say, wait a minute. Before you tell me just your lipid profile here, I want to know, do you have these inflammatory markers in your bloodstream? And we're taping this video. Come back to this slide here. And these are the 6 tests that I order on every patient that I need to answer that question on. Do they have that inflammatory fire burning in the walls of their arteries or don't they? So I want to know about your oxidized cholesterol. Tell me your oxidized LDL. And Quest Labs and LabCorp, they're happy to do these. These are routine tests now. So I check their oxidized cholesterol. As the artery wall starts getting inflamed, prostaglandin 2, known as F2-isoprostane, shows up. So I want to measure that. I want to measure their high sensitivity CRP as an inflammatory marker. I want to check their urine to see if their kidney capillaries are leaking albumin into the urine, another sign of artery disease. And then as the plaque starts to soften and get ready to rupture, markers like myeloperoxidase and phospholipase show up in the bloodstream. These are what I want to know along with your lipid profile. If these are stone cold, if these are positive, if you've got elevated oxidized cholesterol, hsCRP, F2 isoprostatine, myeloperoxidase, if these are all rip-roaring positive, and I send you over, and you can ask your doctor, send you over to the ultrasound store there, and they do an ultrasound scan of the carotid arteries in your neck, and they see plaques sticking out of the artery wall with all sorts of swirls and eddies here setting up clots. Man, you got the disease. Yes, you have atherosclerosis. And you need to get on Dr. Caldwell Esselstyn's reversal diet immediately and follow it to the letter. And I'll show you the basic rudiments of that. The key, along with whole plant foods, is to eat a helping of dark green vegetables several times a day. Why is that a key part of the diet? Plus putting a little bit of balsamic vinegar on it, which helps the body generate nitric oxide. The reason is, as you keep the kale and broccoli and charred Brussels sprouts in your bloodstream, hour after hour, so to speak, 3-4 times a day, you're eating this, and this is trying to keep you off the operating table. It's not extreme. What happens is, as the weeks go by, the antioxidant molecules that are pretty much constantly in your bloodstream start seeping into the walls of the arteries. They encounter the free radicals, and they neutralize the free radicals. They quench the free radicals. And in that case, these foam cells are no longer needed, so they leave. They outmigrate. You can see it on the electron microscope. They leave the plaque. And as a result, the plaques get smaller and smaller and smaller. And that damaged endothelial lining reestablishes itself, not by magic, but because the stem cells in the bone marrow are constantly putting out showers of stem cells that reupholster the artery like new paving stones here. And the artery turns back into what it used to look like. Most of you have seen this classic arteriogram from Dr. Esselstyn. But here's the left anterior descending artery in a man's heart, 46-year-old surgeon, had bad angina. Why? Because the entire dye column, the width of the artery, should look like this. But down here, this rat-eaten portion here, these are atherosclerotic plaques that are encroaching into the blood flow channel, choking off the blood flow. He had horrible angina. He had to take a nitroglycerin tablet to walk 10 yards. This man was, should be measured for his coffin if he continues on his current diet and lifestyle. Well, he didn't. He adopted a whole food, plant-based diet, and 30 months later, the plaques melted away, and this artery turned into this artery. Same patient, same artery. Look at the difference. These plaques melted away from the inside, was not on statins. What a greater gift, what a more powerful tool could you bestow upon your patient? Don't we owe them this reality? How exciting. What an exciting era of medicine that we are in. Dr. Esselstyn has published numerous studies on this, and we now find that arteries all over the body open up, much to the delight of people at home. So again, just for those plant-based eaters with high, quote, high cholesterol 218, 222, whatever, realize, I tell them, beware the tyranny of the numbers. Realize that all the risk statistics that correlate elevated cholesterol levels with atherosclerosis and heart attacks and strokes, they're all derived and they apply to people eating the standard American diet, running cooked animal muscle through their arteries 3 times a day. These numbers were not derived from nor apply to people eating whole plant food diets. A diet of rice and beans and fruits and vegetables running through your bloodstream on a daily basis should not injure your artery walls. In fact, they will heal them. That food stream will not make you obese or set you up for a heart attack. So if you're eating whole food plant-based and your cholesterol is, quote, elevated, remember every one of those cholesterol molecules were put there by your own liver for its own reasons. Trust your liver. Now, Joe six-pack American may have the same cholesterol at 218, but every other one of his cholesterol molecules is cow cholesterol and chicken cholesterol and pig cholesterol, accompanied by all the inflammatory free radicals and pro-inflammatory fats, etc. It's a different disease. Even though the cholesterol numbers are the same, one is a benign hypercholesterolemia generated by the person's own liver versus the inflammatory assortment of molecules coming from the standard Western diet. Trust your liver, okay, if you're truly eating whole food plant-based, but make sure your diet is non-inflammatory. It can't be junk food, vegan diet filled with sugars and fried foods and processed junk food. If it's really rice and beans and greens and fruits and veggies and all that implies, that food stream should not injure and inflame your artery walls, but have your inflammatory markers checked. And if all your inflammatory markers are stone cold negative, and if you go over to the ultrasound store there, and this is what your carotid arteries look like, smooth and walls not thickened, not a hint of a plaque, you do not have the disease of atherosclerosis, even though your cholesterol is 212 or 214. And I think you do not need to be on statins. Make sure your thyroid is getting all the minerals it needs to, because hypothyroidism can raise your cholesterol. Make sure that's not what you're looking at. But if that's all covered, relax. Trust your liver. It knows what it's doing. I think you are at extremely low risk for heart attack or stroke, even though your cholesterol may be 200 or higher. If you really want to make those numbers better, do a search on the Portfolio Diet by David Jenkins, and they can give you an idea for foods that can help carry cholesterol out of the body. But you're chasing numbers. The most important thing is heal those arteries by following the guidelines put out by Dr. Esselstyn in his book. That's all I have time for specific diseases, but please know, and I tell the med students, so many of the diseases, you're going to spend the majority of your time treating: high blood pressure, angina, obesity, all of these reverse to a greater or lesser extent on a whole food plant-based diet. This is the exciting era of medicine we are entering, and every physician needs to know about this. Now, the people may hear about it. The doctor might be enthusiastic, but people are people. And you think, just tell them once, oh, okay, I'll change my diet. Well, people don't do that. Why not? Because there's barriers, and we have to honor that and respect people. First of all, personal taste. People grow up. My daddy always made me bacon and eggs on Sunday morning. We always had turkey fish on Friday evenings. We always had roast beef on Wednesdays, whatever. And these are hardwired into us, and we've got to honor that. And you can gently modify them. Find out what I ask. What's the person's favorite food? I'm Italian. I want my spaghetti. Well, great. How about pasta primavera instead of pasta with meatballs? I like my burger. Well, there's great burgers available now. We'll talk about that in a minute. If I've come from Hispanic culture, well, there's lots of, you can make lovely plant-based bean burritos. From an Asian background, there's lovely curries and stir fries, etc. You can meet the person, find out what their favorite foods are and modify them to a whole food plant-based version. And I'm okay if the person, listen, I don't want to go become vegan tomorrow. Great, then taper it off. How about getting your meat eating down to once or twice a week instead of twice a day? And it takes them 3 months, 6 months to slowly taper the meat products out of their diet. Fine. It's taken them their whole lifetime to get where they are. If they need to eat it once or twice a week for 6 months, a year, fine with me, but keep moving in that direction. And these transition foods, the Impossible Burgers, whatever, they've got their issues. They're processed food. They have salt and fat, et cetera. Yes, but they don't have cholesterol. They don't have pesticides. They don't have herbicides. They shouldn't have heavy metals. They are on some levels significantly healthier. But you don't want to eat them every day. They're treat foods. But if they can help Joe six-pack American meat and potato guy bite into it and say, "Oh, I could eat that. That's vegan food. I could eat that." Then I think those foods have a legitimate place in the diet as transition foods. There comes a point you stop eating them. We have some in our freezer that have been there for months. I don't know what's the next time I'll have another one. They're a treat. Every 3 months I'll have one. But again, just for fun, not a staple part of my diet. Then there's cultural issues that we really have to respect. And I grew up in an Asian household, a Hispanic household. Well, seek and you shall find. Just look on the internet. I got Italian heritage. Well, great. Do a search on low-fat vegan Italian recipes. Your screen will fill up with those kind of recipes. East Indian, well, great. Plenty of recipes for making low-fat, healthy, whole food, plant-based, and Indian style. Hispanic recipes of all types. There's lovely stir fries and curries from in Asian style. Yeah, it's there. You can meet people. You can honor their culture without overriding it. Now, economics are an issue. I've got young docs saying, listen, I practice in a food desert. There's nothing but 7-Elevens around. My families can't afford this kind of eating. You know what arugula costs these days? And absolutely, economics is a major issue, and we cannot make light of that. But it turns out that the staple foods are cheap. You can buy 10 pounds of rice for a little over $6.50. You can buy 10 pounds of lentils for less than $12.50. And SNAP Food Assistance pays for these. Well, one person can eat for 2 weeks off 10 pounds of rice and lentils. If you just have 2 cups of rice and a cup of lentils for lunch, and the same again for dinner, 53 grams of protein just from the rice and lentils. So the staples are very economical. And if you're not paying, for T-bone steaks and ice creams and things, you got money left over to buy the broccoli, to buy the kale, et cetera, even the organic stuff. And practicing good medicine is beyond operating rooms and outpatient clinics and cath labs. I've got a couple of young ER doc friends. Every Saturday, they take their empty pickup truck to the farmer's market. At the end of the farmer's market, they go around to the vendors and they say, whatever food you haven't sold, can we buy it from you for pennies on a dollar, or just give it to us? And they load up their truck and they take it back to their neighborhood and they give it to the food bank. They do a mini food truck sales for very cheap. They're not there to make money. But this is a high level practice of medicine, even though it involves a pickup truck and some work gloves. This is how if you love your patients, what you're willing to do to help them. And then finally, there's the social issues. Is the family on board? Are they antagonistic? No one wants to see dad with a stroke. No one wants to see mom developing Parkinson's. I tell them, God forbid you get a heart attack or a stroke. It's only you in that hospital bed. It's not your spouse. It's not the people at work. It's not your daughter-in-law. Just say, if you decide to eat healthy, plant-based, say, listen, enough with the jokes. I got to do this because I got to do this. I don't want to wind up in a wheelchair. Here, help me. Yeah, I'll make the food delicious, or we'll order, healthy food here. But I don't need offhand comments here. Help me eat healthy. And what happens, of course, is that everybody winds up eating healthier. The food tastes so great. So love and delicious food goes a long way there to overcoming these barriers. So where do you start? Tell your patients, go to find the film called Forks Over Knives. It's on Netflix. Watch it. They will see people getting healthy right before their eyes on a plant-based diet. Then tell them to go back to the Forks Over Knife website. They've got recipes and transition plans to help them transition. I find a little bit of too much salt and oil in some of Forks Over Knives recipes, so I strongly recommend Rip Esselson's Plant Strong program. Very reasonable. They've got guidance to help you, coaching, meal planning. You'll find a whole community of folks making this transition. So check out Plant Strong. Rochester Lifestyle Medicine has a wonderful 15-day jumpstart program. Take advantage, cheap. $150, I think, just a superb program that will take you by the hand, change your life forever. Just wonderful. Here's the Plant Pure Communities, Nelson Campbell's crew, have a wonderful 10-day jumpstart program. So there's plenty of programs to help you make that transition. And there's professional allies already out there. There's a fleet, battalions of plant-based dietitians. Every place I give this talk, I check out the local dietitians in the area that are plant-based. I gave this talk at the University of Buffalo, Here I was at Northwestern University in Evanston, Nova University in Broward County. I was at Razorback Land in Arkansas. I spoke at Baylor in Houston, Texas, and Go Blue and University of Michigan, Ann Arbor. I was at Brown University in Providence. I spoke at Harvard in Boston, spoke at Rutgers in New Jersey, Yale in New Haven, UC San Diego. Every place there are plant-based dietitians who will do this counseling for you, doctor. You don't have to do it. Find the plant-based dietitian, send the patient to them, and you can get to see the patient back in a month, see if they're not healthier and more educated. If they follow the advice, they certainly will be. I urge the young doctors to come back to this slide and go to every one of these websites. There's an education waiting for you. Dr. McDougall's newsletter is an course in itself. Speaking of courses, go to the website of the University of Winchester. They've got a 6-week online course in applied plant-based nutrition, and lay people benefit from this as well as professionals. I took it. I learned a ton. Go to Physicians Committee for Responsible Medicine, PCRM, and they've got CME programs free for the taking: weight loss, diabetes, heart disease. You can download their medical reference guide, and I've got a patient with lupus or colitis. You can know what dietary orders to write for them. You can make lifestyle medicine a career. Here's our friends up at Rochester Lifestyle Medicine enjoying their practice. Join the Plantrition Project. You'll meet plant-based doctors from around the world, India, Indonesia, Ireland. It's so exciting to see meet these doctors whose plant-based awareness is burgeoning around the globe. I urge you to join. I tell the med students, join the American College of Lifestyle Medicine. They are very supportive of plant-based diets. So we're at the end. I know it's been a lot of material. Excuse me. But they say once you look behind the curtain, you can't pretend you don't know what's behind the curtain. And my job with the medical students and to you is to tear down this curtain and say, look, the era of applied, nutrition-based lifestyle medicine is dawning. Just Band-Aid, patch-em-up medicine is expensive and inefficient. We want to heal these patients, then let's deal with what they're eating and how they're living their lives. And the plant-based wave is breaking. Line up your surfboard. I tell them, I am the happiest doctor I know because my patients get healthy right before my eyes. And I invite them to become the happiest doctor they know. This is the most powerful therapeutic tool available to any physician to truly heal their patients on the deepest level. And the invitation is to learn about it and then use it in your practice and your own daily life. We need healthy doctors. If you want to learn more about our work, how we're trying to get this word out to medical schools, I want to visit every medical school in the country via Zoom and around the world. Go to my website, drklaper.com, and click on Moving Medicine Forward. You'll see what we're doing and how you can support us. And I invite you all to join our monthly forums. It's free of charge. And click on Moving Medicine Forward and click on Clinical Nutrition Forum. And once a month, I bring in clinicians from across the spectrum of plant-based nutrition and talk about all sorts of clinical conditions. And then the last half is Q&A for the participants to ask the authorities. So they're really lively, wonderful programs, free of charge. I invite you to join us at our next month's forum. So this is what I wish I learned in medical school about nutrition. Through Moving Medicine Forward, this information is being shared with medical students today around the world. So the invitation is to help us spread the word. Talk to your doctor about it, talk to your medical student friends, and live a healthy plant-based life. Be a good example that spreads the word better than anything else we can say or do. So with that, thanks for your patience. I will stop sharing here and I will open up for questions for the next half hour.
All right. Thank you, Dr. Klaper, for your presentation today. Before we open up the Q&A session, we basically want to explain something for our fellow attendees. So normally we don't take questions directly from the chat. Instead, we ask everyone to virtually raise your hand. If you're not sure how to do this, what you need to do is to click on your reactions tab at the bottom of your Zoom window, then click on the raised hand function in the menu that pops up. We will then take questions in the order in which we receive them. When it's your turn, we'll unmute you and prompt you to ask your question. We ask that everyone keep their questions brief and on topic. And in order to give everyone a chance to get their question in, we won't be taking follow-up questions. And with that, let's go ahead and get started. You ready, Dr. Klaper?
I'm ready.
Okay, great. All right, so first we have Jennifer. Jennifer, the floor is yours.
Hi, I was wondering how much protein we need.
Not very much, right? We're Americans. If a little is good, more must be better. And so the average suggested amount is around 50 grams. A penny weighs 3 grams, so that's about 20 pennies worth of protein. Well, it turns out that that's really an excessive amount of protein for pretty much every human being. The actual amount of protein, amino acids that you need to replenish your enzymes and build new tissue is about 20 grams a day. Truth of it is, but they double that to get it into the 40 or 50 range. So again, the good way to do this if you're plant-based is emphasize those protein-rich foods. And basically those are the legumes, beans, peas, chickpeas, lentils, anything in a pod is a legume. Have something with legumes most every day, a scoop of lentil stew, some bean chili, a hummus sandwich. Find ways to get legumes into your diet. Whole grains, quinoa, oats, rice, millet are very rich in protein. And nuts and seeds, so throw a handful of walnuts on your salad, etc. So it's easy to get in that 40, 50, 60 gram range. I'm not a big fan of these really high protein diets that the bodybuilders inflict on their bodies. I think that's damaging to their kidneys, etc. But if you can, shoot for 50 grams of protein a day, you'll easily make it on a whole food plant-based diet.
Okay, thank you, Dr. Klaper. Next, we have Stephanie. Stephanie, please ask your question.
Hi, Dr. Klaper. Thank you so much for doing this. From your presentation, I'm wondering if for someone who's trying to reverse like blood pressure or any cardiac issues, if there's such thing as adding good healthy fats to the diet, or if I should just steer clear from them all, period.
Oh, thank you for that. That's a very perceptive question. And I hoped I was making clear, I am not anti-fat. We need fats. It's an essential nutrient. Your skin oils are made of fats. Your hormones are made of fats. Your brain cells are wrapped in fats. We need some fats every day. The key to really living healthy and eating whole food plant-based is get your fats out of whole foods. Get them out of avocados and walnuts and olives and flax seeds, and get your fats out of whole plant foods rather than glass bottles. Oils have a problem with them. And why are you down on oils? A couple of reasons. When you eat a walnut or an olive, the micro droplets of walnut oil or olive oil are firmly attached to the fiber of the walnut, of the olive. And you chew it up and swallow it. It takes hours for your digestive enzymes to get into that piece of walnut or piece of olive, and for the amylase enzymes to start breaking down the starches, and for the lipase enzymes to come in and start emulsifying the fats, and then you absorb the fats into the bloodstream. And a very small amount gets in, one passes through the liver, pretty much cleared out of there. It doesn't have much of a pharmaceutical effect, fats from whole plant foods. But you crush those olives, you crush the coconut, and you get the fat out. This is liquid fat in the bottle. This is pure olive fat, pure coconut fat. And you pour a couple of tablespoons of that on your food, nothing slows down the absorption. That leaps into your bloodstream. Now you got 2 tablespoons of liquid fat floating in your bloodstream, and it starts having pharmaceutical effects that the natural fats didn't. The fats can soak into the walls of the arteries and paralyze that nitric oxide mechanism that allows for dilation of the arteries. The fats can work their way into the muscle and liver cells, making insulin resistance worse. The fat can inhibit blood clotting, increasing risk for bleeds if people hit their heads. These oils start exerting pharmaceutical effects, which is why we're not big fans of large amounts of oil. Now, I've had chefs come up to me, Doc, I cook Asian food. Are you really telling me that 3 drops of sesame oil in my Asian sauce here is going to give anybody a heart disease? No, it won't. and a teaspoon of olive oil on your salad, and no, it's probably not going to cause any great harm. But those folks that are pouring the olive oil, ooh, Mediterranean diet, ooh, heart healthy, more oil the better. Those folks, I think, are doing themselves great harm. That's where these pharmaceutical effects of the oils show up there. So get your fats out of whole plant foods. And again, I put 2 tablespoons of ground flax and chia and hemp seeds on my morning oatmeal. I have a handful of walnuts every day. And my fat balance seems to be just fine. So that's the issue with the fats and the oils. But you need the fats. Eat those healthy fat-rich foods in the whole form.
What about canned coconut milks for like soups and recipes and stuff like that?
First of all, I'm a big fan of coconut water. Yay. We have coconuts here in South Florida. I open them with my machete. We drink the water. Great stuff. Coconut milk is a strange man-made phenomenon. They take the coconut meat and then they put it in a high-powered blender and they blend it. It's a slurry of coconut meat and coconut oil. Is that healthy? Not particularly. Again, it's liquid coconut oil. A small amount, to add a little flavor, texture to a sauce. Okay, I guess. Like the toxicologists say, the dose makes the oil. The dose makes the poison. And probably a little bit isn't going to hurt you, but man, you don't want to be eating large amounts of that stuff every day. So don't push your body, don't push your luck. Less is more, and none is probably best of that.
Thank you, doctor.
Thank you.
All right, thank you, Stephanie, for that. Oh, we got a lot of raised hands. Okay, so next we have Gwendolyn. Gwendolyn, please ask your question.
Yes, thank you for the opportunity for helpful information. My question is, my husband's been a vegan for over 25 years. However, his homocysteine went up. And will vitamin E and vitamin C help reduce those? He has a ratio of omega-6 and omega-3 of 8 to 1.
Wow. You got a ratio of omega-3 to omega-6, 8 to 1. Wow, you're eating a lot of omega-3s. Good for you. But your homocysteine is elevated. Is it over 15? How high is it? Is it?
Yeah, the range is to 14.5, but it's 14.9.
Yeah.
Also, in regards to that, could any type of environmental factors affect that?
Yeah, you may need you need vitamin B12 and folic acid and selenium to help lower your homocysteine level. And so there are different forms of vitamin B12. I would suggest you go to methylcobalamin or hydroxycobalamin. And for a good 3 months, for 90 days, I would do 1,000 micrograms daily for 3 months, then recheck your homocysteine. And if it's down, don't want to eat too much B12, then you can drop back to like 3 times a week. But try a different form of B12 instead of the usual cyanocobalamin. Go to methyl, and if that doesn't help, then go to hydroxy or adenosine cobalamin. So try these different forms, see if that doesn't help bring that. It's not dangerous. It's elevated. You'd like it below 12 if you can. So change your form of B12.
Thank you so much.
You're welcome.
All right, thank you for that, Dr. Klaper. Next, we have David. David, there you go. Your floor is yours.
Hi, Dr. Klaper. How you doing?
Good.
I had 2 quick questions. One is, what is your decision about algae oil? I know you sent samples in and you were conflicted about algae oil. And then also, would you recommend, as Dr. Joel Furman suggests, to avoid brown rice because of arsenic?
The second one's easier. I eat very little rice now because of the damn arsenic, and we fouled the nest and it's catching up with us. So we mostly, when we want grains, it's mostly quinoa and millet and buckwheat these days. We eat rice maybe once a month. So yes, I'm with Dr. Furman on that one. As far as the algae oil, there's a very strong argument made to take it and not to take it. I'm still in the not taking it camp yet. I was about to say, I better start taking it again. But I've done more reading and more research, and I don't want to get into the weeds too much on the metabolism of DHA, et cetera. But my concern is the folks who have the low omega index, low omega-3 index, and mine is down at 3.7 or whatever. That's just what shows up in the blood. What it doesn't tell you is that the alpha-linolenic acid that's in the flax seeds and the chia seeds, et cetera, is stored in the tissues, and the body turns that into long-chain fatty acids in the tissues. It doesn't show up in the blood. In fact, it wouldn't make sense for the body to take the linolenic acid in the flax seeds and chia seeds and turn it all the way into DHA, because the 5 intermediate steps, the SDA, the ETA, those the body uses them. For cell membrane construction and prostaglandins, et cetera. And if you go right into DHA, then you wind up inhibiting the enzymes that make these other substances get inhibited. So I'm wondering, what are we really doing? And that it might be just a clumsy, heavy-handed way to just come in with this end product DHA. What about all the precursors above that? Didn't the body need those as well? So I'm afraid in our good intent, we might really be skewing a very sensitive mechanism here. So I started taking it a couple for a week or so, and then I've read more about it, and I've pulled back again. So don't deprive yourself of the linolenic acid. You've got to have the flax seeds and chia seeds and hemp seeds and dark green leafy vegetables and walnuts. Absolutely keep them in there. But I'm not so sure that just because your omega-3 blood test is low, that your brain tissue is shockingly low. I have yet to be convinced of that. So I'm still doing more research, and so I still have not started taking the DHA. I've got it in the fridge, but I look at it and say, I'm not sure what I'm doing when I'm taking this. What am I doing to those enzyme steps further up there? And we know too little to say it's a good thing to be doing. So I'm still on the not taking it fence, but I may jump over the other side. I'll let you know as I do more research.
Well, the previous speaker said also the rancidity is an issue, whether it's fish oil or even algae oil. And he said it could also lead to cancer if it's rancid. And he said most algae oils are rancid.
I've heard that as well. It's a concern. It's kind of an unnatural product to distill those oils there, get them out of foods. And again, the conversion takes place in your brain cells, muscle cell, liver cells, not out in the bloodstream. And so I'm putting less and less weight on your omega-3 index. What is it really telling you? It's not telling you what's happening in your brain tissue.
All right, thank you.
You bet.
Okay, thanks for that. Next we have Ainsley. Ainsley, please ask your question.
Hi, Dr. Ainsley from Trinidad. It looks like we are neighbors. My question is, vegan now, 1 year, 8 months. How long does it take for our cells in our body to purge itself from the meat that we ate before? That's my first question. And my second question, you mentioned something about coconuts. I normally take my afternoon walk around a big park, and being tropical, we have the coconut vendors there selling coconuts. Is it good to have a coconut water after we exercise?
Oh, I think coconut water after you exercise is lovely. It is ambrosia. I've been told, I've not seen medical validation, but that it is so close to human plasma that in a pinch, the people who start an IV and run the coconut water in. But I think it's a lovely rehydration beverage. Absolutely. I'm a big fan of coconut water, especially after a walk. How long does it take your cells to clear? Especially with this high water content diet, most of these contaminants will flush out when you go fully plant-based. After 90 days, I would say most of them are pretty clear. Your body's constantly turning over cells, et cetera. Over the course of 3 months, I think you're pretty much in the clear. Certainly 6 months, you got pretty much a plant-based body there.
The next person up is Nicole. Nicole, you've been unmuted. Go ahead and ask your question.
Yeah, thanks a lot, and greetings from Germany. Do you have any advice or any experience for someone who's suffering from a perineal paralysis, a drop foot, following a surgery, a hip surgery? And I'm not asking for a friend.
I'm sorry, what is the condition? I missed the name of the condition. What is the person suffering?
Well, they hit a nerve doing a hip surgery, and now I have a dropped foot. It's a peroneal paralysis, and I was wondering if there's anything I can do food-wise to enhance nerve, the reversal of the whole thing.
Right. How long ago was the surgery? Recently or years ago?
It was like 20 months ago.
Okay. At this, there are foods. Again, you're someone, because the myelin sheath on nerves involves healthy fats. And the lignans, etc. Flax seeds are, I would have ground flax on your cereal pretty much on a regular basis. You want to eat lots of root vegetables for the minerals that are in them, because your body's got lots of repair to do. The thing to do is not to despair and to persevere. Nerves take forever to heal. They are the slowest healing tissue in the body. It may take years before you finally get some movement back there. So don't let those muscles atrophy. Keep working with the physiotherapist, do the exercises at home, do whatever you can do to keep those muscles moving. Collateral nerves can open up to start innervating those muscles that the main peroneal nerve isn't doing any longer. So keep working and don't despair. You've got a year or two of intensive work to do, and with little luck, you'll get a fair amount of this repair back again.
The next question is from Honor. Going to unmute you if you could ask your question.
Yes, I'm wondering how much genetics is affected by all of this, because my family has hypertrophic cardiomyopathy, VHL, Rett, and rheumatoid arthritis within just 2 generations of us. So I know at least I will benefit with it, but what can you do about the genetic part?
Oh, it's huge, and don't mean to minimize it at all. And genetics are so powerful on so many levels. Determined for eye colors, everything about us. Only now are we starting to get a little peek through that crack in the door there that we used to think, when I was in med school, your genes are your fate, man. Whatever your genes call for, that's the disease you're going to get. Well, now we know that we can turn those genes on and off by our diet, our lifestyle, stress levels, etc. So I agree, that's a heavy hand that you've been dealt with there, no question. And you're probably going to have some versions of these conditions showing up. You want to keep them as modest as possible as far as your heart muscle goes and your joints go, etc. Keep your gut healthy as far as a leaky gut, etc. And you do the best you can. It's it still comes down to the same point: eat a whole food, plant-based diet, and stay active, man. Keep that heart strong. Keep those joints moving. Avoid the obvious inflammatory thing, fried foods and processed foods, etc. And you do the best you can. And eventually, as we're seeing with animals, etc., even though the strain of animals may have a genetic propensity, if you change the diet of mother-daughter, by the 5th or 6th generation, the gene is much less expressed. So I think I caught a little bit of that question in your what you were posing there. So again, a whole food plant-based diet, and use those joints, and it'll be what it'll be. And you do the best with the genetic hand you've been dealt.
Thank you. Next question is from Bin. I'm going to unmute you. Please ask your question.
Hello.
We're still having problems. I'm going to mute you back up. If you want, why don't we try, if you can send us a text via chat, maybe we could answer the question if we see the question on chat. But we'll put you aside for now and see if you can send that. I'll keep my eye out for it, and then I'll ask the question for you. So the next person up is Lois. Lois, I'm going to unmute you. And if you could... Goodness.
Hi, Dr. Klaper. Thanks for taking my call.
You bet.
I am also one of those people who needs to reverse coronary blocked arteries. I have atherosclerosis since I've been 55. I'm 72. I've been vegan. I'm now considering Dr. Esselstyn's program, but I was confused by your comments because someone recently asked you the question about healthy fats and reversing blood pressure and cardiovascular disease, and you said it was important. Yet Dr. Esselstyn's program allows for only 1 or 2 tablespoons of flax or chia a day. Can you clarify, please?
Oh, absolutely. Thank you for making me clarify that. That's an important distinction. For most folks who do not have artery disease, I don't think they have a problem of putting a slice of avocado on their salad or throw a handful of walnuts on their oatmeal in the morning. And again, you need some fats every day. But if you are someone with clinical artery disease, you've got angina when you walk, you've got a blue leg that's not getting circulation, you've got official artery disease. Fats, except the bare minimum, are not your friends. Dr. Esselstyn is right. And if you really want to initiate those plaques melting away off the artery walls, then you got to be on a really low-fat diet. Not forever and ever. 6, 12, 18 months, 2 years, whatever, till you're symptom-free, till your inflammatory markers are down. So the ultrasound shows you got good blood flow. Then you can add a handful of olives to your salad or whatever. So again, there's zero in the way of oils. And as far as the whole foods that are fat rich, avocados, nuts, whatever. If you don't have artery disease, have a modest amount of them. If you've got artery disease, be 100% pure Esselstyn and avoid them for a good year or 2 or 3 till you are symptom free and your arteries are clearly healing. I hope that clarifies it.
Thank you. The next up is James. I'm going to unmute you if you could ask your question.
Doc, it's a complete honor talking to you. What would you advise somebody who's almost 7 years into remission from lymphoma and been on a whole food plant-based diet for about 3.5 years? Any words of advice?
Oh my. Well, good for you that you're in remission. And from my experience, I can talk from experience. When I was working at True North Health Center, we had 2 patients come in with lymphomas. And I figured, write their death certificate. Just the opposite happened. We were stunned. Both of them, one did a water fast, one did a juice cleanse. The lymphoma tissue melted away. We've done a 5-year follow-up on one of them. She is clear of lymphoma. That particular type of tumor responds really well to a whole food plant-based diet. You don't want to don't want to poke the bear there. Fried foods, oily foods, meats, dairy, I think will wake the dragon up again and help that to grow. But now lymphomas are special cancers. Now, not every cancer responds like this, but lymphomas, they're a distortion of natural tissue of lymphocytes. There's still, there's constant turnover in those cells. Plus lymphomas are watery tumors. And so the changes in your blood from the whole food plant-based diet works its way into the lymphoma tissue and starts working its magic in many different ways, sirtuins, et cetera, et cetera. That's opposed to some of the really gnarly, meaty tumors. If you've got an osteogenic sarcoma of the bone, that doesn't melt away so easy, or a big squamous cell carcinoma of the lung, or bronchogenic carcinoma of the lung. Those are tougher cancers. So in a way, you were, quote, lucky to have a lymphoma, and they do respond. So the best thing is to thine own cells be true. Don't cheat on that lymphoma. It will wake the dragon up. So when you're out at the restaurant, order as clean as you can. When you're shopping, don't bring home the junk foods there. And if you do that, and the green and yellow vegetables are stabilizing in general. And so something green and something yellow should be on your plate pretty much every day. Some steamed greens, some big salad, carrot, squash, etc. for the yellow vegetables. Dr. Joel Fuhrman has a lovely recipe for anti-cancer soup, and it's full of greens and mushrooms, etc. Do a Google search on Dr. Fuhrman's anti-cancer soup and make up a big pot of yourself and have a few cups of that during the week. So those are the things I would do. So you got away, quote, lucky. I mean, if you've been in remission 3 years, so keep eating healthy and clean, have a positive attitude, and hopefully the thing won't come back on you.
Thank you so much. Next up is Sophia.
Hi.
Question.
Hi, do you hear me?
Yes, I can.
Hi, Dr. Klaper. Thank you so much for taking my question. You helped me a lot in the past with the Paddison program used to answer our questions and so on. And my knee, I felt better at a period of time, but unfortunately, synovial inflammation, though I am vegan, keeps up growing. And I even developed a toffee around the muscles, like hard bumps. So I have to put knee braces constantly to be able to stand up. So I wonder what else I can do that I'm missing.
Wow. Didn't catch all that, but your rheumatoid arthritis seems to be getting a bit worse, and you got nodules now in your tissues. Yeah, right. So you're someone who may benefit from repeated brief fasts, a 3-day fast or up to a 5-day fast at home once a month, twice a month. But you don't want to get too skinny, lose too much weight. But we often, when I was at True North, we would have people come in, do a fast, get tremendous response in their tissues. They start eating again, and often there would be a flare up of their tissues. And Dr. Goldhammer would say, man, some of these people got to come in, do 3, 4, 5 fasts before they finally get a hold of this thing, till their gut flora changes, till their joint tissues change. So, but many people can't afford to go to True North Health Center for weeks at a time, many times during the year. So, an at-home program of water or vegetable broth fasting, start with like 3 days, just over a weekend, Friday, Saturday, and Sunday. And you could do that like every other weekend and see if you don't start feeling better. And maybe once a month, do a 5-day or there. Don't go past 5 days. And see if those don't help. You may, if you have not checked one of if you don't know Dr. Brooke Goldner, Goldner, go to her website called Goodbye Lupus. And she can help you overcome your autoimmune disease as well. She's got a remarkable philosophy. She's a great example as well. So set up a program of brief intermittent fasts and go to Dr. Brooke Goldner, Goldner website and join her crew and see if she can get some more practical information for you.
Thank you. Next up is Sylvia. I'm going to unmute you. Please ask your question.
Yes, thank you, doctor. My husband has prostate pain. He's had it for over 3 years. He's had MRI, CT scans. He's been checked out thoroughly to rule out any serious issues, but he continues to have extreme prostate pain. He is just miserable. And he is whole foods plant-based he has been for about 1.5 years.
So he's having prostate pain, you're saying?
Yes.
Does he have a prostate cancer or not, as far as you know?
No, he does not.
He does not.
They've
Right.
tested him for everything. His
Right.
PSAs come back, great. And like I said, he's had MRI, CTs, and CT scans. They haven't found absolutely nothing. And, but yeah, he has some very bad pain.
Well, this is a really subtle, complex issue here, because you wonder, where's the pain coming from? Is this to put a finger in the rectum and push on his prostate. Does he go ouch or doesn't he? Is the prostate itself tender, or could this be referred pain coming from the spinal nerves that he's feeling in the prostate, but the problem is really up in the lumbar vertebrae or the sacral vertebrae? He needs an MRI of his lumbar sacral spine for sure. He should have an MRI with contrast, with intravenous contrast injected, to look at the blood vessels to the prostate. He might have a blood clot in one of the veins in the prostate gland. There might be an infarction of the prostate where he's lost some tissue there. This might not be prostatitis at all. I'm sure that's what they're thinking. I'm sure they've given him antibiotics that haven't helped. So this pain, as you described, might be coming from somewhere else altogether, from a nerve impingement or blood clot or something else. So get an MRI of his lumbar spine and an MRI of contrast of his pelvic organs, and see if the radiologist can identify some other source for the prostate pain that he's feeling.
Okay. Thank you so much, doctor.
You're welcome. Good luck.
Thank you.
All right, thank you, Dr. Klaper. Unfortunately, that's all the time we have left for our Q&A. Yeah, sorry for everyone who had their hands raised. We tried to get to everyone, but Dr. Klaper, thank you from me, and also I want to have everyone else thank you. So I'm going to unmute everyone from the participants window. So everyone, say something to Dr. Klaper.
Also,
Thank you so much. You're so great.
That was amazing.
Good job.
Do it NHS.
Thank you, Dr.
Amazing.
Amazing.
Good thing.
All right.
Hey, shower you with love.
Take a bow.
I love it.